Very good evening, friends. Meeting again in the session of Robert's philosophy, and we're discussing the chapter number 27, the syphilitic miasm continued. And in this chapter, Robert has tried to correlate syphilitic miasm in relation with the Sora as well as syphilis, or Psoro-Syphilitic and psychosis. So comparison between all three miasms have been done by Robert in this specific chapter. So he has taken into consideration what are the soric earmarks, that is the Sora presents with the very clearly the functional manifestations over there. It itches and looks to be unwashed, unclean. Then he explained about syphilis, it ulcerates and affects the bony structures producing deformities. And third miasm, psychosis, where he explained that the infiltration followed by a very severe acrid discharges corroding the parts. These are three earmarks of all three miasms, and then he started explaining one by one what is the difference between the headaches of tubercular miasm and syphilitic miasm. If Sora dominates in tubercular miasm, the functional manifestations comes more. If syphilis dominates, then the structural manifestations comes first. All those things he tried to explain over there. And last paragraph, we have discussed about the urinary tract affections. And in the urinary complaints, last complaint which we have discussed is about the nocturnal enuresis, and nocturnal enuresis during the first sleep. That is very characteristic of this specific miasm over there. Then second important thing, in the tubercular miasm, one more feature that prostatic hypertrophy is always comes under the tubercular miasm. So this is what we have learned in earlier lecture. We were there on page number 222. Let us start with the third paragraph. That is the syphilis seldom attacks the ovaries and uterus. So this is the place of psychotic miasm. Ovaries and uterus is never the first place of syphilitic miasm. It is always with the psychotic. In pathological conditions, we occasionally find a manifestation of tubercular diathesis, but this is because of soric affinity for the functional and emotional disturbances, and not because of syphilitic influences towards these organs. So, most important thing is that if there are any symptoms which are related with the uterus, or if there are any symptoms which are related with the ovaries, if they are present, they are functional manifestations of soric and not of the syphilitic miasm. So emotional disturbances causing some problems with the menses or suppressed menses because of some grief, suppressed menses because of some anger, all those things which comes under the sphere, those are soric in origin, and those comes in Psoro-Syphilitic miasm. Otherwise, structural changes directly never comes very commonly with the syphilitic miasm over there. The syphilitic stigma attacks the long bones. Very important feature we explain. Syphilitic stigma affects long bones. Bone is the very characteristic place where the syphilitic miasm affects. The growing pains of children are syphilitic, especially when aggravated at night and aggravated in storms or change of weather. So these children or those children usually complains that they have very severe pain in bones, and as night comes that their problem starts aggravating. During sundown to sunrise, their problems are always aggravated, specifically related with the bones. This stigma causes destruction of the tissue partly because it hampers assimilation of the necessary elements, and we see the result of rickets in children. So rickets in children, characteristic syphilitic manifestation or tubercular manifestation. They cannot assimilate for their food what they require to make the bones sufficiently hard to support their weight without bending. And that's why they are having a curvature of bones called as rickets in Marathi. We label it by the name of murdus. So very typical rickets characteristic entity comes under the syphilitic miasm or Psoro-Syphilitic miasm. It is not the product of pure Sora. The nails of the patient. So earlier paragraph, you saw just right over there on the book, it is related with bones. Now he turns towards the nails. And characteristic nail manifestations are there. The nails of these patients are characteristic, being paper thin. Very important thing is the paper thin. Paper thin means they are very thin, spoon shaped, another important feature, and bending and tearing easily. Where the nails are irregular, brittle, break and split easily, and with many hangnails, this is an unfailing sign of the tubercular miasm. So when syphilitic is attached with psora, then nails are irregular, they are brittle, they break and split easily with many hangnails. These nails are also spotted, so there are white spots in the nails with white specks and scalloped edges. Phelons about the nail are manifestations of combined effects of syphilis and psora, as are all periosteal affections. So, very characteristic affection, nail bed affection is phelon. And these phelons, whenever are present, then it is very painful. It is manifestation of this tubercular miasm. In Marathi, we call it by the name of nakhurd. We called it at the base of nail or in the nail bed. There is an infection and causing a very severe trouble for the patient. The Psoro-Syphilitic patient cannot endure much cold. 8. They cannot endure much heat. Extremes of temperature aggravates. So this is very typical of tubercular, but more sensitive to the cold than heat. The heat from the stove may drive them from the room. So excessive heat also drive them out of the room. That is another indication. But generally, they are more sensitive to the cold than the heat. Chilblains are combined of the all the stigmata. Anyone who has endured the torments of this affliction can readily understand how willing these sufferers are to accept any form of treatment which promises some relief. Yet a suppression of this manifestation brings on its strain of succession of all sorts of nervous diseases and many other serious conditions, even to the malignancy. Chilblains are very typical skin manifestations, very infective where cellulitis is more marked and they are so painful. Generally, they are because of loss of blood supply to the part and they are so painful, troublesome to the patient. They are combined effects of all three miasms. And when, if you suppress them with the help of some local measures, it enters inside, affects anywhere. Generally, it can lead to the cancerous growths or cancerous manifestation. So suppressed chilblains always leads to such grave condition, and that's why if anyone who is treating the chilblains, he should not suppress that. Keep it in your mind. And even if patient is suppressing it, ask him, don't suppress it, otherwise it can lead towards the cancer. And I have seen it many times in my practice that when you treat cancer, these chilblains comes out. One more manifestation I have observed in my practice was when you treat the cancer, many times herpes zoster also comes up. These are very important things one must learn. Corns and like hypertrophies are tubercular manifestations. Generally, pure corns are psychotic more than psychosyphilitic, but if they are infected, then definitely that leads towards the psychosyphilitic miasm or psoro-syphilitic miasm. Boils are usually sore, but when there is much suppuration and pain, it is usually combination of psoric and syphilitic manifestation. Phelons, nail bed affections, infections. So tubercular miasm. So boils are usually psoric. Yes, simple boil is a psoric, but when it is associated with severe pain and much more suppuration, then it is always tubercular. It is characteristic of psoric eruption that they tend to dry down and scale up rather than to suppurate. However, the appearance of boil after the administration of the antisoric remedy is a welcome and encouraging indication. So if you treat any patient with antisoric remedy for his complaint, internal complaints, and if boil recurs over there, it is a very good sign. It indicates that patient is in right direction because it is going from the internal organ to the surface and in the form of a boil. So even though it looks pustular, but it is a good sign. Children who have weak wrists and ankle joints, who have difficulty in holding on to subject, who drops the things easily, who are clumsy in getting about and stumble over the straw, are manifesting the effects of combined syphilis and psora. For this combination affects the tendons about the joints by weakening them so that they will stand the strain of much use. This is one more feature. Weakness at the level of tendons, specifically at the insertion or origin, and because of which the clumsiness happens. Things falls from their hands. Which is the remedy? Remedy you must know.
Gelsemium.
Yeah, but gelsemium is a different. It is apis mellifica, acquardness. That is called as acquardness, and they drops the things from their hands. It is awkwardness which you get with apis. Second important thing, weak wrist and ankle joints, which is the remedy for weak ankles, recurrent sprains, recurrent strains.
Lidam pal.
Yeah, but more important, recurrent mm, sprains of
Strontium
ankle.
carb.
It is natrum carbonicum. More common is the natrum carbonicum, where you get weak ankles and there is recurrent sprain. See, natrum carbonicum, again a remedy from psychotic or tubercular miasm. So you get these combined effects over there, and the weakness lies at the level of the insertion or origin of the tendons over there. As we naturally expect, there are great many skin manifestations with the syphilitic miasm and in the tubercular dyscrasia. There are pustular eruptions which suppurate, and eruptions occur especially about the joints or in the flexors of the body. These eruptions are quite prone to arrange themselves in crescentic formation. In color, they are coppery or brownish, but sometimes very red at the base of pustule. Most striking characteristic of this syphilitic eruption is that they do not itch, and there is very little soreness. In these eruptions, progress to scaling and crush, as they usually do, these are very thick and occurs in patches and circumscribed spots. He is explaining the typical eruptions of Psoro-Syphilitic miasm. Psoro-Syphilitic miasm, you get, if it is syphilitic domains, you'll get more scaling, crust formation with scaling, and that. So where you must know the skin disorders where scaling is more marked. One very common is psoriasis, but where the easily detachable scales are there. Lichen planus is also a papillosquamous disorder where scaling is present, but it is not easily detachable. Remains attached to the skin, and it is not so strong, or it is not in ample amount as compared to the psoriasis. Psoriasis, you get the silvery white scales. Even alteration in the skin, specifically vitiligo, or also called as leukoderma, these are psoro-syphilitic. They are tubercular in origin. So mixed miasmatic traits, psoro-syphilitic, where you get the skin manifestation where destruction is often seen. In psoriasis, you get the destruction. In lichen planus, you get the destruction. In vitiligo, it is melanocyte destruction. So syphilitic dominance is there. There are symptoms are very less. There even psoriasis is there. Itching is not so marked with the psoriasis. Same is true with lichen planus. Itching is not the very important thing, but the pathology of a destruction, you can find it out over there, and those are manifestations of combined stigmata psoro-syphilitic. One more very specific indication which comes under the psoro-syphilitic miasm is ringworm. Ringworms are always tubercular. So you find it out in the tuberculinum itself. You can get it in bacillinum. You can get it in sepia. You can get it in natremure. You can get the same thing in aracioidide. You can get it in Kali arsenicosum. where you will going to get their circumscribed spots and ringworms or petiform eruptions. And those are very characteristic of this specific stigmata. So tubercular miasm always have many varieties of pathological skin diseases. The gangrenes of the skin and dry gangrene show the destructiveness of the syphilitic stigma. So gangrene is always a manifestation of syphilitic miasm. Skin affections with glandular involvements are frequent. Occasionally, psoriasis shows itself. Psoriasis has been called marriage of all the miasms or stigmata, but its characteristics are predominantly psoric and psychotic. Another type of eruption where all the stigmata are present is fish scale eruption. What is fish scale eruption? Fish scale eruption is nothing but the ichthyosis. It is so dry in skin where you can find it out. It looks like as if a fish scale. So it is a hereditary disorder generally. So marked dryness of the skin which you can locate over there. In this condition, we have dryness of psora and the squamous character of syphilitic eruption and moles and the warts of psychosis. So you can get that as a combined stigmata, and that's why you can find it out such types of eruptions over there. So see, every miasm presents its own specific disorders. And once you know that this comes under the specific such and such miasm, you can think about the remedy which has that capacity, which matches that miasm. Then and then that remedy can cover, otherwise it never covers. Varicose veins are of tubercular origin. So underline that. That is very important. Varicosity, very specific of the tubercular miasm. Most important remedy is lachesis, or another important remedy which you can get over there is the hemamelis, which is very specific. Third important remedy is sepia. We generally forget, but sepia has very specific action on the venous system. Varicose veins are of tubercular origin. Varicose ulcers are the last destructive manifestation on the skin of the syphilitic tail. So varicose veins is tubercular, but varicose ulcers are syphilitic. So you can easily find it out the miasm over there. In this stigma, two, we see ecchymosis and hemorrhagic condition into the skin. Ecchymosis is nothing but the petechial hemorrhages. Those are generally found to be there in thrombocytopenia. Puerperal conditions are all manifestations of syphilitic taint. So this is what he is explaining over there. Idiopathic thrombocytopenic purpura, very characteristic of this specific syphilitic taint. So you can find it out such types of eruptions very commonly over there. Then he says erysipelatous and carcinomatous conditions, epithelioma and lupus. Lupus is lupus vulgaris. It is tuberculosis of the skin. Are all manifestations of the union of three stigmata. So if there is a cancer of skin, it is a manifestation of all three miasms, union of all three miasms. Even lupus, it is not purely just tubercular, it can be a combination of all three. In acute exanthematous diseases, we see the tubercular diathesis. These conditions show the psora in the severity of the attack, but profound prostration from the lowered vitality is mark of syphilis stain. So generally, whenever such types of disorders, exanthematous disorders comes, they after that disorder, patient has a tremendous prostration, exhaustion, and that is because of the syphilitic miasm in background. So it is a psoro-syphilitic tubercular. Urticaria occurs in tubercular diathesis. Marked freckling is also a manifestation of tubercular diathesis, and this has a clear, almost transparent skin of tubercular patient with pigmentation of psori. One more important thing, generally, if the patient is phosphorus, you are going to find it out very typical, very delicate skin, where vessels are visible. That is tubercular manifestation. Second important thing which he has mentioned is freckles. Freckles are nothing but the brownish spots appears on the skin, generally on the face. Freckles, they are present on the, in case of females, it is called as gloeosma. In case of males also, you can get sometimes freckles over there. These are brownish pigmentation over there, and that is also has a tubercular miasm in the background. Impetigo will readily develop in a combination of psoric and syphilitic miasm, while those without this dyscrasia will not become infected. Impetigo is a latter version of simple boils. Boils turning towards the impetigo, a staphylococcal infective focus generally. Those are very typical manifestation of Psoro-Syphilitic miasm that never remains to be only purely psoric miasm. We often find patients with slight wounds that heal very slowly and not at all. This condition is due to the union of syphilitic and psoric influences. In this same category, we may place the stitch abscess, which occurs after following operative measures in the hospitals under the best of sanitary conditions. So, delayed healing of the skin, a tubercular manifestation. It is also a manifestation sometimes of a psychotic miasm also. We have spoken a great deal of tubercular diathesis as being the combination of syphilitic and psoric stigmata. The scropular diathesis is also a combination of these two stigmata, but it differs in proportionate degree of the presence of the taints and is further influenced by suppressive measure of crude drugging. Probably, environment and circumstances have some bearing on it also. However, the suppression is strong factor in its individual expression because this has buried it deeper in the system. So what he is explaining, the scrofulous diathesis is characteristic of tubercular miasm. Glandular affections, lymph node affections, these are very, very characteristically present in this tubercular miasm or Psoro-Syphilitic miasm. And to conclude the chapter, what he says is very important related with scrofulous diathesis. The scrofulous diathesis manifests itself largely by involvement of glandular system, particularly in the lymphatics. While many authorities have classed scrofula as psoric, its relation may be traced by its manifestation. Psora has no glandular involvement, but syphilis has particular ability for glandular tissue. Scrofula has many symptoms in common with psora, but it has the same tendency to ulceration as syphilis. This relationship may be seen also in purulent discharges and decomposition of the exudation. Scrofula has the same tendency as syphilis to locate the organs of special senses, such as the eyes, ears, nose, lips, etc. The pernicious anemia of scrofulous patient resembles very closely to the syphilitic parent and shows its kinship to the tubercular diathesis. So he has explained that scrofula is very specific to this tubercular miasm, Psoro-Syphilitic miasm. And to conclude what he says, pernicious anemia is of the scrofulous patient resembles very closely to the syphilitic parent. So there is very characteristically hemolysis which happens over there and anemia develops. Generally found to be there in this combined stigmata, Psoro-Syphilitic miasm. See how clearly he has classified syphilitic miasm, clearly differentiates the syphilitic miasm with Psoro-Syphilitic miasm in this chapter. And it concept becomes more clear if you read the Roberts again. My suggestion to all of you who are practitioners over there, read those chapters once more. You're going to get very clear idea about the miasm. So 2 chapters from the syphilitic miasm we have finished. The third one, last one, which we have to discuss, where he has again explained about the one of the postulate that is higher the atomic weight, more syphilitic is the remedy. And that we'll learn on Monday's session. So thank you being there and meet again on Monday at the same time. Good
Thank you
evening.
very much.
Thank you, sir.
Okay, welcome.
Thank you, sir. Have a good evening.
Thank you.